Good afternoon, everyone. Thank you for joining us for this very important press conference and opportunity to focus our attention on how this Patient Protection and Affordability Act will help small businesses in America. Many of us entered this debate with this focus. We understand that 60% of the unemployed Americans, of the uninsured Americans, work for small businesses. We understand that small businesses, like all Americans, are struggling to afford health insurance. The reason that this is important is because when small businesses can afford health insurance, their profits go up, wages for employees go up because health costs go down. Business people that know how to balance their budget have said to the federal government, we're balancing our budget. It's now time for you all to try to get your budgets in balance. And so the concept of fiscal responsibility, the concept of trying to use as much as we can in the private sector to meet the needs of small business is important. In the underlying bill, we have created for the first time exchanges that are going to be open to individuals and to small businesses, businesses actually up to 50 and potentially up to 100 employees. We have direct tax credits for the first time. In addition to the deduction that businesses receive now, small business, those 10 and under, those 25 and under, will get a substantial credit until the exchanges begin, and then once the exchanges begin, we'll get an exchange credit. So I call that the bridge credit, a bridge to the exchange, and then the exchange credit. Senator Lincoln, who had took great leadership in crafting these tax credit proposals, will speak about it in a minute. We're extremely proud of her efforts on the Finance Committee to this end. We also have no employer mandate in this bill, which was very important to small businesses. We do have a shared responsibility provision for businesses above 50, and we can talk about that. But individuals now, the concept is, will be responsible along with small businesses to figure out a way to share those costs as larger businesses do now. And then, of course, we have general insurance reform, which we can go over in more detail. But small businesses are the beneficiary of strong insurance market reform so that they aren't dropped. So their employees, particularly if they're in a small business with 5 or 6 or 7 or 8 employees and one gets terribly sick with cancer, the premiums go so high for everyone else. What can we do to fix that? We're addressing it in the underlying bill. We have with us today two outstanding senators. As I said, Senator Lincoln, who has led this effort for many years, particularly now as a member of the Finance Committee, and she's here to talk about the provisions of the SHOP Act and an amendment that we plan to sponsor on the floor that will even expand and make more generous the tax credit for small business.
Small Business Majority strongly supports this package. We've been fortunate to work with the senators here over the last year on a lot of these ideas, some ideas that have already been incorporated into the legislation, and we're really thrilled to see these amendments expanding the tax credit so more companies would qualify, moving up the timetable so that small businesses get relief because a lot of them are just hanging on a thread. I think you all probably saw the article in the New York Times recently talking about the 15% average healthcare premium increase small businesses are getting hit with this year. But when you're actually out there talking to small businesses, as we do on the ground, that's just an average. A lot of them are getting hit with bigger increases. And this is the opposite of our economy. We're in a recession, sales are down, you're getting hit with increasing costs. It really doesn't add up. And a lot of people that have hung in there for years providing these healthcare benefits are right on the edge, and they've been having to renegotiate every year and figure out how to make it work. So there's the Other amendments here in the package to expand. We've been working on this too with the senators in terms of allowing companies up to 100 to enter the exchange. We believe the larger the exchange and the more companies that can participate, the stronger the exchange is going to be. It's going to drive down the cost. It's going to reduce any chance of adverse selection, which has destroyed many insurance pools in the past. So this is really good amendment too. Also, they have an amendment in here to help the self-employed. We've got 22 million self-employed. Let's think, not just fishermen like I grew up in Alaska, but we've got 2 million family farmers out there who are basically self-employed, producing 80% of the food in this country. They're self-employed and they have a tax disadvantage, and this bill is going to address it. We've got a couple million realtors out there who don't actually work for those big companies we see advertising. They're all self-employed, and they have to go to the individual market. So not only are we talking about the exchange here to make it easier for them to access better quality and lower cost insurance, but we're righting a wrong in the tax code, giving them the same tax advantage that all other companies have. So these are really important amendments, really go a long ways to building on the strong foundation with the exchange in the legislation and the insurance reforms, which are all going to be very good for small business. So we're really excited to see this package of amendments, and haven't covered them all. And there's some other smaller ones in here, but they're very good too. So thank you very much.
You know, I've been thinking about healthcare reform for a long time, and you know, a lot of the talk and criticism of the work that's being done on healthcare reform centers on a question of how will some of this be paid for. And I can tell you that nobody is as sensitive to that issue as somebody like myself, as a guy who's had to make payroll every single week for the last 15 years. And this question seems even larger in light of our current economy. But as an entrepreneur and business owner, I know that it's even more important not to let one problem prevent you from solving another unrelated problem. And it is this concept, I think, which looms largest in the face of the recession. Many small businesses are unable to provide health coverage to their employees. And those of us that do provide coverage are slowly being dragged down by these costs, particularly in the last few years. Something that we once considered a benefit that I was proud of being able to provide, has now come to be seen as a burden. A burden, by the way, to be feared, because you don't know what's going to come next. And after years of astonishing rate hikes and declining competition among the providers, so I have a much smaller pool now of people to choose from, many businesses like mine may only be 1 or 2, and this is true, may only be 1 or 2 years away from having to cut our health care programs entirely. I'm not going to let it put me out of business. I'm just going to say we can't do it anymore. And that's why I'm here today, I think as a reminder that the need for health care reform is urgent and essential, and these amendments in particular bring relief to my businesses and businesses like mine and our employees that much sooner and that much greater of a pool.